Hi guys, this is Dr. Park again. Today I wanted to share with you a personal story that really frustrates me. So I currently work as a traveling doctor in Northern California, and I do house call visits to um, Medicare patients over the age of 65 years old. And and it really shocks me to see how many patients, over 80% of the people that I see, have some kind of chronic low back pain that's really poorly managed. And as part of the job, I'm supposed to check their medication list. So I asked them, do you take any medications? And it really shocks me to see how many patients, they not only just take one or two pills, but they bring out this ginormous basket of pill bottles. Okay, got it, went away. I'm trying to show it to you here. Yeah, this is the pill bottle. This is the pills. These are the basket of pills that people commonly take. And it's not just one or two, but it's like, over 10, 20 different medications. And that includes narcotics. And these people, when I ask them, are you feeling any better? And they're complaining about how much they're still in pain. They can't do the things they want to do. And a lot of people can't even walk on their own. They need to rely on walkers like this, or canes, or sit in wheelchairs. And you can see that they're really hunched over. They're very fragile. They're just, every movement is a big effort for them. And they look so depressed. They complain to me how much they can't do anything that they've always wanted to do, like hiking, gardening, playing sports, and going fishing, etc. And these people, they weren't always like this. They were once very young, healthy, active people who just happened to have some kind of low back injury that was very significant along the way, and that was poorly treated. And it gave them a lot of pain, and it knocked the wind out of their lives, so they just became very sedentary. And they just left it poorly treated. They probably didn't have good doctors to really help them a lot. Probably they went to these doctors who just merely said, "Oh, I'm so sorry. There's not much we can do for you. You're gonna have to live like that for the rest of your life, or maybe get surgery if you don't get any better. All I can do is just write you this prescription for this painkiller medicine, and maybe refer you to physical therapy. That's all I can do for you. I'm so sorry." So these patients just, fall into a victim mentality after, hearing these negative opinions from doctors, and they become very depressed, demoralized, and many people just fall into very unhealthy habits, eating unhealthy foods, junk foods, and they gain a lot of weight. And down the road, they develop all these series of chronic illnesses that come with obesity, such as diabetes, high blood pressure, heart attacks, strokes, osteoarthritis, and they become even more debilitated and live a very poor quality of life. And so overall, like, chronic low back pain itself is not a life-threatening illness, but because it debilitates people from becoming physically active, it becomes a precursor to highly morbid conditions down the road. And when you think about it, what good is it if you are alive but you're not able to truly enjoy life, being active and going exploring the world? You're just kind of confined to your own room and sitting in the chair, and just being in pain all the time. And it frightens me to see that this has become a norm in our American society, in our elderly population. And we're all one day going to become that age, like over 65 years old, except for those people who don't make it to that age. And I definitely don't want that to be my own reality in the future, nor do I want it to be yours. So the conventional Western medicine has clearly failed in properly treating chronic low back pain. It's very limited in what it can do. The narcotics, the muscle relaxant pharmaceuticals, the epidural steroid injections, the nerve ablation treatments, and the back surgeries, they're all merely very unnatural, forceful, costly attempts to merely temporarily mask the pain symptoms, but they can't address the underlying cause of the problem. They only cause more complications by causing a lot of side effects long term. So over the past 10 years, I've been in medicine. I not only went to medical school and studied Western medicine, but I also took a year off to learn personal training and nutrition. I lost about 55 pounds, got into the best shape in my life, and I became an endurance athlete doing triathlons, ultra marathons. And then I also got into yoga, and I spent a year in between medical school and residency training to do this yoga teacher training program. And I really intensively studied the body alignment, the anatomy and physiology of yoga. And I went into a family medicine residency training in LA. And I also had this very severe, significant chronic low back injury that led me to learning Chinese medicine. So I studied acupuncture, Chinese herbal medicine, and also mind-body techniques to really lead to holistic healing. So based on my experience and experimenting on my own body, using my body as a guinea pig, I really figured out a good system on how to holistically heal chronic low back pain. So today I'd like to introduce to you to my new transformation program called the Step-by-Step Health Coaching Program on how to holistically heal chronic low back pain and get back into the game of life in 12 weeks. So this program is designed for people who are kind of similar to my situation, people who are in their 20s to 50s who have low back pain that lasted for more than 3 months, that is very debilitating, but otherwise had been active and healthy before, like athletes, who have already seen multiple doctors to rule out more serious causes of low back pain, such as cancer metastasized to the bone, traumatic vertebral bone fracture, or spinal abscesses. So those things I won't be able to help with, but people who've ruled that out and have gotten a diagnosis of some kind of a lumbar muscle strain, herniated disc, ruptured disc, or degenerative disc disease, or of a non-specific cause that's deemed non-surgical, people who've exhausted their options with going, getting pharmaceutical treatment, getting epidural injections, physical therapy, multiple chiropractic sessions, or self-implemented exercises that are not really helping that much. And people who are open-minded and are motivated to commit to a more holistic approach of therapy in a structured way at home for 12 weeks under my guidance to recover and get back into the being active in their life. And I designed this program only for people who are truly committed to investing in themselves now. People who are motivated to follow through the lessons, people who are action takers. I can promise that I will be a cheerleader for you, and I will guide you through step by step to become resilient and overcome the pain and gain strength and flexibility that will continue on for the rest of your life. But this is definitely not a program for people who make excuses, like people who say, oh, I don't have the time, I don't have the money, I have 5 kids at home I have to take care of, I have a full-time job, so I can't really afford to spend money and time on my own well-being. I can't really help those people. But in fact, if you keep making those kind of excuses, you know what's going to happen down the road. You're going to end up being like one of those people on the walkers taking multiple pharmaceuticals in your future. So keep that in mind. So for those of you who are watching this video and who happen to have chronic low back pain and who feel like you need help, I am the person who can help you. Yes, I can. So I'd like you to click the link above and fill out the form with your basic information, and I will get back to you within the next 48 hours to set up a 10-minute set call, and we can discuss how I can help you better. And if you know any person around you who can benefit from watching this video, please feel free to share this video on their Facebook page, your friends, your family members, your acquaintances, your loved ones. I would really love to reach out to as many people as possible to help people in need. But I only have 5 spots available, so you would have to act very quick if you're one of those people who need help. Okay, so thank you very much for your attention, and please stay tuned for further videos in the future. Have a nice day. Bye bye.